Let me very briefly introduce myself. My name is Christopher Bailey. I'm the Arts and Health Lead at the World Health Organization. And thank you for participating in person and virtually to our Healing Arts Symposium, where we're going to be exploring this virtuous triad between research, policy, and practice in the healing capabilities of the arts. But before we get into all of that, I always find it useful to start with the simple reality of what we're talking about here. And to do that, of course, being at WHO, I consulted an expert. And this expert, his name is Carlos, and I met him here at the Metropolitan Museum yesterday. And we met in front of that Japanese painting, you know, the wave. It's this giant tsunami, and in the background there's this little echo of Mount Fuji. And so I meet him in front of that, and he's looking at it, and he's sitting in his stroller. And he's not saying anything, mostly because he hasn't learned how to speak. And let me explain. This is how he communicated to me. Now, what was he communicating? In the first step, he was experiencing a state of deep attention. He was looking at this two-dimensional object and seeing the colors and the contrast in the forms, and then suddenly there was a moment of recognition where he saw this concept of a wave, and it became, in his imagination, three-dimensional. And it was both in movement and still. And these oppositions, these contrasts, began to form a moment of shock, of recognition, but then a sense of awe of the past of this process coming together. This is what Aristotle called a catharsis. And it's found in every rhyming couplet, in every punchline of a joke, in every catastrophic turn of events of a plot. And it's essential to the aesthetic experience, because in that moment, a new neural pathway is formed, and dopamine is released into the brain, giving us a sense of awe and presence. And in fact, that second part of what he did, of pointing to the object and then looking up at me, is what we call shared attention. So more than just a personal discovery, he validated it by seeing if I saw the same thing and was feeling the same way. So his isolation in his little new body, suddenly he realized there was someone else who was feeling the same thing. And in fact, every museum, every auditorium, every theater, every stadium, in some ways, is a temple to shared attention. And it all comes back to the same root ritual from 70,000 years ago, in which religious ceremonies, in which performance, in which healing ceremonies were all the same thing. And they still share some common DNA. Now, the first time that I experienced an event that was a performance event with an explicit healing intent was in Kenya about 20 years ago, and this was at the height of the AIDS epidemic. And at that moment, I was in a four-wheel drive vehicle going through the Kibera slum just outside of Nairobi. And at the height of migration season, the Kibera slum is about a population of around 1 million. And at this moment in time, that key demographic of people between 16 and 25, there was over a 50% prevalency rate for HIV. There was no ARVs. There still is no vaccine. It was like an atom bomb being dropped on this community. Now, even then, we did know how to prevent the spread of AIDS, and through safe sex. We also knew how to communicate that, the facts of that, and yet it wasn't having an effect. People were still, out of fear, grasping on to quack cures. They were still, out of fear, rejecting the science, that it wasn't enough simply to present the factual information. There had to be some other way of engaging them. So as we drove this vehicle through Kibera, and you have to imagine a shanty town that is stretching from horizon to horizon, made up of corrugated tin roofs and whatever materials I can find to prop up this warren of this community. And you could smell the smell of roasting corn on charcoal, and the car was kicking up the red East African dust, which settled like a dew on the skin and the clothing and the hair. And as we pulled up into the quad, the clinical director came to us, and my colleague addressed her and started asking her, what do you have in terms of health promotional material to stop the spread? And she said, well, we don't really have any material per se. And he said, well, we have these pamphlets that maybe they could help. And she looked at them, and with a smile especially reserved for well-meaning Mzungu, she said, well, these are in Swahili, and most of our population speaks Kikuyu, and we don't really have paper or ink. It's too expensive. And they're kind of addressing the wrong thing. It's hard to explain. Why don't you just experience it? So she took us across the quad, and we left the hot African sun into the cinder block building and went into the cool darkness of the building and could taste that taste of cinder block, that copper taste in the back of the mouth. And as our eyes adjusted, we could see this bench across the longitudinal wall and about a dozen Kenyans sitting there. And we sat down in silence, and we shared a bowl, and we washed each other's hands. Plates were distributed, and we gave each other rice and lentils, and we ate a meal in silence. And then a woman, the leader, stood up, and she began to sing this song about AIDS prevention. And she carefully took out a condom, and she began to roll it on this black mahogany phallus. And then she began to sing a song about having pleasurable sex with a condom. And everyone began to sing the chorus, and then she took the phallus and handed it to the next person, who then improvised the next verse, and everyone joined in the dance and the chorus. And this went on and on and on until the phallus came to me. Now, I don't sing, and I don't speak Kikuyu, but I didn't want to be rude. So I sang the first song that came into my head, and it went something like this. I have often walked down the street before, but the pavement always stayed beneath my feet before. All at once am I, several stories high, as I walk down the street where you live. Now, the women who were trying to dance were getting increasingly frustrated because they couldn't find a danceable African beat to this Broadway show tune. But then when I hit the high note, they began to ululate. People stop and stare, they don't bother me, for there's nowhere else on earth that I would rather be. Let the time roll by, I won't care if I can be here on the street where you live. So they all laughed, and the clinical director, beaming, said to me, they want to know what the song means. So I said, well, it's about having pleasurable sex with a condom, of course. That's how art saved millions of lives in Africa.